everybody. I'm Dr. Mark the Cowboy. I'm a board-certified family physician, been practicing for over 20 years, and I've developed this YouTube channel to pass on some important information, tidbits and things that I've been telling my patients for years, and some newer things. I've got ideas of things I want to cover, but I'll also be open to topics that you guys want to hear about. Just keep in mind I'm a family physician, and so won't have expertise in every field, but will certainly have some information for you. Anyway, today I wanted to talk about a very common issue called hypertension. Hypertension is high blood pressure. And so first of all, what's the definition of that? Well, there's a little bit of a debate going on with that, but in general, you could say that trying to keep your systolic top number under 140 and your diastolic, which is the bottom number, under 90 would be a great goal. So what happens if someone does have high blood pressure and they're not doing anything about it? They're not taking care of it. Over time, this high pressure system is putting stress on the brain and on the heart and on the kidneys, all of your internal organs. Certainly leads to earlier heart attacks, strokes, all kinds of evidence of that. So what creates high blood pressure? Well, I always say that blood pressure is kind of like plumbing. You got how hard is the pump pumping, what's the total volume of fluid in the system, and then how big are the pipes being our arteries. And there are, first of all, there are blood pressure medicines that work to come at all three of those angles that create the pressure to lower it. And your doctor can certainly find a medication or a combination that will help. And in most cases, one medication, occasionally two, are needed to get someone down to a goal number. My personal goal for people, though, is to be able to obtain normal blood pressure and not need to be on medication. So how do you do that? Well, we have to think a little bit about those three principles of the blood pressure: how hard the pump is pumping, total volume of fluid in the system, and the size of the pipes. And so the pump, for example, if you have a more efficient pump, then at rest, it's going to be very easy for that pump to maintain the blood pressure and won't have to work as hard. If you have a healthy diet and you don't smoke, or you quit smoking if you do, we tend to have better arteries, more wide open arteries, better flow, and keeping yourself hydrated is very important as well. The kidneys are actually one of the major regulatory organs of blood pressure, and essentially they're a big filter. And if the kidneys are not happy with how much circulation they're getting, they'll actually kick out this chemical called angiotensin and converted to aldosterone. Anyway, more information than you need to know, but they will kick out these chemicals that cause vasoconstriction and raise the blood pressure. And there are medications that work to fight that. And what they do is they're called ACE inhibitors and angiotensin receptor blockers. But anyway, they basically dilate the artery going into the kidney to improve the circulation, and then the kidney's happy and it doesn't kick out those chemicals. All right, so anyway, back to what things you can do to improve your blood pressure. There are things you can change and there are things you can't change. You can't change your family tree. You have genetics, and there are some people who literally do everything right and they still have high blood pressure and have to be on medications. It's certainly not the norm, but there are certainly people out there like that. I can tell you that the majority of people with high blood pressure certainly could improve it and have a really good chance of getting themselves off of blood pressure medications with enough weight loss if they're overweight, and improvement in their physical fitness. I probably have 36 patients now who were on blood pressure medicines, some of them on diabetes medications, and over a course of about 6 months of changing their lifestyle, with eating better, eating an appropriate amount of calories for their size and age, and then improving their physical fitness with exercise, and not just cardiovascular exercise. Actually, strength training makes huge changes too in our circulation. When you strength train, you have to build muscle, and it requires a lot of factories to get turned on while we're sleeping to rebuild and repair those muscles. So a lot of more metabolism is happening. So increased metabolism is going to lead to some weight loss just in and of itself. Over time, you build more lean muscle mass, and that's increasing your calorie burning engine. But what also has to happen when you make muscle, you also have to make the blood vessels to supply this new muscle. And so you're increasing your vascular tree, making it a bigger system, so that lowers the blood pressure. I have always been a doctor that would rather have a visit where I'm stopping medications for people rather than starting them. And the success stories are the people that listened and really took the bull by the horns and got to the gym, started working out, eliminated the junk calories in their foods, quit smoking if they were smokers, and it happens over not that long a time, a matter of months. So I like to refer to a TV show that was on a few years ago called The Biggest Loser, and many of you have maybe seen it. There were contestants basically trying to lose the most weight, and whoever lost the most weight would win the $100,000 or $500,000, whatever it was. And these people were morbidly obese. I mean, they would come onto the show weighing 300, 350, 400 pounds. And quite honestly, it took Western medicine by surprise. The amount of success that these people had in a matter of 90 days or 6 months. And they simply were eating healthy diets and had the proper amount of calories for them. And they were exercising both cardiovascular and strength training. And it was a tremendous eye-opener, very successful for a lot of people, and hopefully motivated a lot of people to make similar changes. Anyway, bottom line is that's really the take-home message, that you've got blood pressure that is genetic that you can't do anything about, and okay, your doctor's going to have to help you with that with some medications. And then B, you've got options to improve your pump function, improve your circulation, decrease the workload on your pump, and improve the blood pressure. And you still may need medications while you're on that journey, but majority of the time people are able to at least reduce meds and in a lot of cases come off of them. So I hope this video was helpful, and I'm going to be making several others. If you enjoyed this, if you feel like you got something out of it, please like the video and subscribe to my channel. Have a good day.